think that medical professionalism is the job of the individual clinician practicing on their day-by-day basis. It's all well and good having regulations and other things, but as an individual, every single day you're able to see your patients and treat them with the respect and care that they expect, and it's your job to ensure that you are behaving professionally at all times, regardless of what others around you are doing.
Medical professionalism, I think it's every medical professional's responsibility to ensure that high standards within the medical profession are maintained. This includes medical students as well, because we are working towards achieving that medical qualification, and I think the role should start right at the minute you set foot into medical school. The role should start there and then, to ensure that by the end of it you have constant reminders, and that by the end of the day you have a highly qualified doctor with good standards of care.
I think it's a combined effort. It's quite a complex jigsaw puzzle where a number of pieces fit together to make us the doctors that we are, the good doctors that we are.
Medical professionalism is the responsibility of everybody within the profession, so from students all the way up to consultants, clinical directors, anybody who's part of the profession. At the end of the day, any of our actions can alter the public's view of the profession, and so ultimately we're all responsible.
I would agree with Charlie and say that it now extends not only on our everyday lives but also what we do on online as well, so it encompasses a lot of things now.
I think that medical professionalism is and always has been all of our jobs, so it's all doctors. We still, the way that most doctors know what it is to be a good doctor is we think about what our own practice is, we get feedback from our colleagues, and then we look to others to be able to give us some other guidelines and things. But it's always been all of our jobs, and the interest in some of the discussion here has been like, what should the direction be? Should it be more towards accountability or more towards improvement? And the feeling in amongst the group was that it should be more towards improvement. And somebody tweeted back to me as I was tweeting from it. He said, you can have accountability without improvement, but you can't have improvement without accountability. You need the accountability for it to stick. And I think that's the thing, that actually improvement is a higher aim than accountability.
So we definitely believe that it's the responsibility of everybody who is working within the NHS. So that includes medical students, that includes doctors, that includes even the healthcare authorities themselves as well.
It's everybody's job, because great changes and great improvements are made by acting together.
More importantly, it's your own job, as even with the guidelines being drafted, if you don't perform on those guidelines and adhere to those guidelines, we're not going to make an improvement unless you perform individually, and then hence collectively you make an improvement.
I think everyone involved in healthcare is responsible for medical professionalism. The doctors, the nurses, the physios, everyone that works, even the porters who carry the patients from ward to ward.
Ultimately, I think it's everybody's responsibility, but I think there should be a pressure put on the team leaders and Board of Trustees at individual hospitals to create an environment where juniors feel able to raise their concerns in order to make a change. Training people from the bottom up simply won't work in institutions where they might just get assimilated into the bad practices.
Well, it's obviously the responsibility of the medics, but they will never achieve it in a solitary situation. They will have to partner with everybody else. So I really welcome the conversation. I think it's fantastic they're having it. I think there is a bit of a watershed around issues of trust, issues of changes in demography, pressures on the system. The vast majority of people love the medical care they get and really, really appreciate it. And I think we need to celebrate that. But at the same time, there are big changes that are needed. Education has changed. The patients are much more educated than they've ever been. They've got information available to them. Some of it's reliable, some of it's not. But nevertheless, they are more informed. So doctors need to work with patients to actually determine their patterns of care. And if they involved patients in creating those pathways of care, they'd be much better. I agree that a doctor must be technically competent, but they need to have good people skills, they need to treat people with dignity, with respect. And if they can incorporate all of that in partnership with the patient, they will really, really be great professionals that we'll all value.